can now talk to the First Minister of Northern Ireland, Arlene Foster. Thank you very much for being on the programme today. We've already heard from the Welsh First Minister. We're going to be hearing from Boris Johnson later. What's your message to what people in Northern Ireland should be doing now?
Well, good morning, Sophie. It's good to be with you this morning. We had to review our regulations last week, and based on the advice that we had been given from our own Chief Medical Officer and Chief Scientific Officer, we were told that this reproductive number, the R0, was around 0.8, 0.9 for Northern Ireland. And given that that was the case, we decided that we needed to reintroduce the regulations again for another 3 weeks. We will be looking at some nuance changes throughout that time, and we'll await to hear what the Prime Minister has to say today. But I think in terms of the Northern Ireland public, it is important that we continue to protect them and make sure that this virus doesn't start transmitting again in the community in a way that would cause damage to the community. But then at the beginning of this week, we're also bringing out a roadmap that will deal with the economic recovery, society's recovery as well, and this whole issue of how we move to the new normal in a graduated way.
It's interesting to hear you say that the R rate in Northern Ireland, 0.8, 0.9, it's clearly slightly higher than in other parts of the country. Do you think it matters if different nations or different areas move out of the lockdown in different ways?
Well, I think we have certainly benefited from the simplicity and the clarity of the messaging moving forward, but SAGE and indeed our own Chief Medical Officer do indeed recognise that there are different rates of transmission across the United Kingdom. If you look at London, because it went into the infection rate a lot sooner than perhaps Northern Ireland, Scotland or Wales, it has fallen now to, we think, around 0.5, 0.6 of a transmission rate. So there are differences across the United Kingdom, regional differences. I think the Prime Minister recognises those regional differences, and as a result you may see slight differences across the United Kingdom.
There's a difference, of course, between slight differences and more fundamental changes in how different places deal with this. Schools is one area where we could see quite different approaches, with reports saying English primary schools could start to reopen in June. In Northern Ireland, schools, of course, you said, will stay shut until September. Are you worried about the difference this could make to children's education?
Well, of course, we're always concerned about the impact that this disease has had on children's education. Schools have largely been closed since the 17th of March. And that being the case, we want to make sure that we have that graduated step back into schools so that we can protect our young people. And indeed, the Education Minister will be looking at how he can also intervene with young people to make sure that they can catch up on what they have been missing at schools. When you say schools have been closed, of course, they have been opened for the children of key workers and for vulnerable children. I think that's very important because there are many of our key workers that need those schools to be open so those children can be looked after and they can go to work in our National Health Service and indeed our other areas where they're needed.
Yeah, I accept that. An important clarification to make there. When I was talking to Robert Jenrick a little earlier, he was talking about this new system they hope to have in place, a 1 to 5 alert system, where effectively the higher up the scale you are, the more vulnerable the area is to COVID-19, and saying that the lockdown could be reapplied in different areas. Do you think that degree of regional variation is workable?
Well, I do, because I think it is important that we listen to our Chief Medical Officer and Chief Scientific Officer. We listen to the modelling. Of course, we have benefited greatly from being part of the United Kingdom through a lot of our economic packages from, of course, our National Health Service. But it is important that we do what is right in our region of the United Kingdom moving forward. And that's why we're coming with our road plan early next week. That will set out how we can take these graduated steps back to what will be a different normality. It will be a new normality. We will still have social distancing. We will, of course, have to make sure that there are safe working practices. And in that regard, our Economy Minister is working with the Department of Business to make sure that we have all of the same messaging in around safe working for people going back to work. It is important that we give hope to people, Sophie. I want to say it very clearly. But it's also important as First Minister that I protect people. And that's why we're listening very carefully to what our Chief Medical Officer and Scientific Officer are telling us.
How have you found the communication with Number 10? Talking to Mark Drakeford earlier, he said he didn't know what the Prime Minister was going to be saying later on today. I wonder if you know and if you feel that you've been, I guess, part of the decision-making process.
Well, we did have a good conversation, the devolved administrations, with the Prime Minister on Thursday. On Friday, we spoke to the Chancellor of the Duchy of Lancaster, Michael Gove. And again today, before the Prime Minister speaks to the country, we will be part of COBRA, which will take place early this afternoon. I think as well it's fair to say that not just the Prime Minister, but all of the government ministers have been integrated very much with our own ministers, because of course we have had a number of economic packages. But if I look at the haulage package that was put in place for Northern Ireland, I think it's so important that we continue that positive conversation with the government in the United Kingdom as a whole, but as well as that, that we make our own decisions based on the medical advice that we have in Northern Ireland.
Talking about the medical advice in Northern Ireland, I just want to touch on the situation on care homes in Northern Ireland and coronavirus in particular. I was pretty shocked to read that over 60% of COVID-19 related deaths in Northern Ireland from April 25th to May the 1st happened in care homes. Figures reported on the Nolan Show on the BBC Radio Ulster showed that in one nursing home, 36 out of 38 residents tested positive. How worried are you about what is happening in care homes in Northern Ireland, and have those people been abandoned?
Well, there are two parts to this story. Of course, I think if you do a comparison with the deaths in hospital, one of the reasons is a good reason. It's actually because the number of deaths in hospital are falling. I think that's a very positive element to it. But of course, we are very concerned about what's happening in our care homes, and our health minister is very much taking an interventionist approach to that. A lot of these care homes are private, but we have intervened to give support from the health and social care teams here in Northern Ireland. We've also put some dental graduates in who have just come out of college to try and help with that. Our regulatory authority are going in and trying to give advice as to what's the best way forward. We are trying to intervene as much as we possibly can, and I've said often, Sophie, during our press conferences, that these are our most precious and vulnerable residents in Northern Ireland, and we need to make sure that we're doing everything that we can. And when we look back, we know that we are doing everything that we can to protect them.
Thank you for that answer. And just finally, I just want to ask quickly about Brexit. Clearly a very uncertain time for businesses with coronavirus, huge challenges, perhaps unprecedented challenges. Would you have a problem if the Brexit transition period was extended?
Well, at the moment, as you know, we're talking to the government about Brexit. We have a very particular issue around the Northern Ireland Protocol. I have to say we have been engaging very much with the Paymaster General and with Michael Gove recently around that issue. It is important that we get clarity for our businesses in Northern Ireland, and I think that is the key issue. We shouldn't be distracted by talk of lengthening the transition or anything like that. What we need to do is to make sure that we're focused and make sure that we get clarity for our businesses in Northern Ireland.
OK, thank you very much for being on the programme today. Arlene
Foster
there.